All right, we are live, episode 8.
Yes.
Yes, I'm Dr. Robert Fredrickson. Today we have a very special guest. We have Dr. Kyle Meers of the Hashimoto Reset. So, Dr.
Yes.
Kyle, thank you so much for coming on. I'm really excited to learn from you and learn about your journey on how you transitioned, from a traditional chiropractic clinic into a functional medicine niche market.
Yeah.
So, thank you so much for coming on today.
Yeah, I'm excited, man. It's going to be good to talk about, and we got a lot of things to cover in a little time, and we'll get rocking and rolling.
Awesome, man. Hey, well, yeah, tell me about your journey. How did you go to the Hashimoto's? Why did you focus on Hashimoto's in particular? Was there a certain family connection there, or did you just really see like a need you could fix with the Hashimoto's thyroiditis?
Yeah. No worries. I'd say probably just over the last, decade, just being in a brick and mortar practice and going and working with a lot of different clients, and you just see trends, right? So you just kind of see trends and things. And so obviously in our practice, when brick and mortar, we did, we had chiro, we had pain management, we had some acupuncture, we had massage, we had, functional nutrition. So we did a little bit of everything. And so, of course, we took care of a lot of, pain symptoms and things like that. But, when it came to the nutrition side of things, it was pretty similar across the board, where we just got a lot of people coming in with just general thyroid concerns, right? And so, we just kind of looked at that. And in the last few years, we started looking at more and more of those trends and just looking past it, like all of our calls and all of our consults. And yeah, it was just sure enough, 75-80% of the people coming in was just that. And the reason we kind of now got into Hashimoto's is that really, if you just look at the research, a great article of Journal of Endocrinology looked at 90%, almost 90% of hypothyroidism has a Hashimoto connection, meaning they have some level of antibody count, yet they're never checked. And I think that's kind of the problem with, the traditional Western medicine, which, is great in terms of helping to get things managed in the initial sense. But when it comes to, finding underlying causes and really getting down to the under the hood, right?
Sure.
That's where it starts to become more of an issue. And so that's where, we started looking into, okay, so what could we focus on? And Hashimoto is just like, it's such a big one. So we still do general thyroid as well. But, most people we're doing, combined protocols for each, if that makes sense.
Right. And that's an interesting topic because my wife has Hashimoto's, and, it's one of those things like, no doctors, well, I'm not going to say no doctors, but a lot of doctors in conventional medicine aren't checking these TPO antibodies, reverse T3. They're not a traditional lab that you typically get, right? So
yeah, no, and that's the crazy part. So if you look at, we do challenges every month, and we kind of take through clients through and just general public through kind of some of the different things we look for, and then just some of the pitfalls of just modern medicine in general. And yeah, it's pretty standard. It's like, it goes from, you've got to have some kind of overt symptoms, and overt can mean really anything, but essentially for most people that it all starts off pretty benign in a sense, right? You get that loss of fatigue, you get a little bit of weight gain, you start getting the brain fog, you maybe your digestive system starts just malfunctioning a bit. And that's just not enough, for us, being in the functional ward, we're going, hey, that's a problem, right? So, you really shouldn't really feel any of that, right? I mean, if, obviously if you have just a long day at the office, or you're stressed out with the kids or something like that is one thing. Right. But when you start seeing these trends over, month, 2-3 months, we start to say, hey, there's some things, so some red lights going off. Well, the problem with medicine is that, overt symptoms means like you've got to have multiple symptoms. They got to be pretty severe before they even want to run just a basic test like a TSH test. And kind of the reason we started figuring that out is like when you're talking to clients, most of them are going, man, I had a fight to get that test. I mean, I had a fight with my doctor just for them to check my thyroid out, right?
Wow.
And so that's the first battle. And then from there, it's like, that's pretty much like you said, the only test they do. And so if it's high, hey, you get your hormone replacements, you try to get it down, and then it's like recheck every year at your annual physical. And that's it. And then the other thing is just managing those other symptoms with other meds, right? So, we both know, just taking the medication, it's not a lack of medication why you have a thyroid problem, right?
Sure,
it's not a lack of medication why, you have pain, or lack of aspirin, or lack of migraine medication why you have migraines.
I know. Yep.
So yeah, so that's the problem is that if that cause isn't figured out, or you don't start working on the other things, more symptoms will start to come because, thyroid is so important to literally every body system. You need hormone for almost everything to function. And so when those symptoms come, then it's just a matter of now managing those symptoms with other meds. And that's kind of that failure where it's like they don't identify, the underlying potential autoimmunity, and they're definitely not looking at those underlying causes. And that's what leads people down the road of just more and more meds and problems.
Right. And would you say a lot of people who are having maybe hypothyroidism might have Hashimoto's? They just haven't been checked yet. And maybe they're having, an increased level of TPO antibodies.
Yeah. And that's very common. So most people, especially in medicine, I don't believe it's the standard of care to check antibodies. Because most of the people coming in, for my clients are coming in and they've never had them checked. One of the first things we check is TPO antibodies, which have about a 95% sensitivity for a Hashimoto's diagnosis. So basically they did some great research and showed that, TPO, if you had one test to run for Hashimoto's, that'd be a great one. And also TG antibodies, thyroglobulin antibodies. They don't have as high of a sensitivity with the diagnosis, meaning if someone was diagnosed with Hashimoto's, only about 60, 80% of people had TG antibodies versus like 95% had TPO antibodies.
Got it. Yep.
And we'll kind of maybe cover that too, what that means. But yeah, they don't check that. And it's so important to know because, if your thyroid is being tagged, and that's essentially what an antibody is that your immune system is somewhat went rogue and is now tagged your thyroid as foreign, right? Mm-hmm. And essentially now anytime you activate the immune system or do something to raise up your immune system, it'll start attacking your thyroid. And that's what causes the destruction. And that's what leads to the problem. So yeah, just managing and just looking at just simple things like TSH are good for like a baseline. But in terms of the full picture, yeah, reverse T3, total T3, total T4, because you want to see at every point of the process how it's working. It's very important.
Right. And so can you just talk just briefly for anyone listening, like maybe they're not familiar with Hashimoto's, but it seems like it's on the rise. Maybe it's more testing, right? Like with some other things we're testing more, so we think it's more prevalent.
Yeah.
But I think it was Dr. Hashimoto, who's a research scientist, and I think he was actually looking at
it was like in the 1800s or so. Yeah, he's kind of first discovered the antibodies. Yeah, I think, probably some more testing. I think just people become more aware that it's a problem. And again, just goes back to the research too, is that they're just showing such a high correlation with those with hypothyroidism that have Hashimoto's. And I think more and more people, and I know when we do, challenges and we'll get, a few hundred people kind of listening to us and going through this, they're like, oh yeah, you know what? I heard that somewhere else that, I need to get my antibodies checked. But yeah, just in general, like thyroid problems in hypothyroidism, we're talking like 30 million people just in the US, like with some level of like a thyroid issue. So, I mean, it's a very big problem. And in fact, with Hashimoto specifically, it's definitely one of the number one autoimmune diseases out there, in terms of overall, obviously things like RA, and some gut autoimmune diseases are very common, but Hashimoto's really does rank up there as is one of the top ones.
Wow.
And it's just getting more and more. Yeah. And globally it's changing as well. And again, lots of reasons why. I mean, and that's the problem, is that there's a lot of underlying factors. There's about 8 researched areas that lead to thyroid dysfunction. So I think it's just, this combination of the perfect storm, right? And you're just getting so much more exposure, whether it's chemicals or stress can be a huge thing, and dietary. I mean, a lot of stuff has changed over the last, 50 years in terms of just our food and chemicals and everything, right? So it's a lot of stuff.
Yep. And is it mainly women in your practice that have Hashimoto's, or do you see women
mostly
too with
women,
it?
Some men, but it definitely possible, but yeah, mostly women. And there's not really a reason why. I don't know if there's really much research to show. I mean, they have kind of linked a few things to just general hormone imbalances, obviously, because for females, they tend to go through more changes than men do. We have a big shift in our teens, but for females, especially if you've, getting pregnant, go into menopause, shifting cycles. I mean, it can definitely, play a little bit more role with that. So again, not a perfect science in that, and the research isn't completely clear, but yeah, women definitely have more of a problem with it.
Yeah. And it's women age 30 to 50, or do you find them younger now, or?
Yeah, so it's trending down for sure. I mean, so we'll get clients now. I mean, I would say majority of my clients are in their 50s and 60s and things like that. But, of course, I have plenty of consultations in their 30s and 40s. And, just kind of speak to that too, because it's tough, to go through a lot of these holistic changes. And unfortunately, in the holistic world, you and I both know, a lot of times these things aren't covered by insurance, and that stinks. And it drives me nuts. It's like, even if we all send our case studies of our best clients to the insurance companies, they still probably won't cover it, right? It's just because of the nature of the beast. And two, it's like those early symptoms, it's hard sometimes to justify wanting to go through a lot of stuff to get there. But you ask anybody in their 50s and 60s that have had some major problems with their thyroid, they're going, God, I wish I would have started in my 30s and 40s. And, and that's the problem. A lot of Hashimoto diagnosis, hypothyroidism takes on average about 7 years to even get a diagnosis in the first place. And again, that goes back to that idea of symptoms are, a pretty bad judge of body health. Obviously they're the last thing to come, and unfortunately you can degenerate for many years and then all of a sudden have things pop up. So you just got to be real careful. But man, the earlier you can get on top of this stuff and start managing it, obviously the better. But it is hard to, go, man, I'm not doing too bad, so it's like, do I really want to make all those food changes and lifestyle changes? It's
right.
Tough. Yeah, well, I totally get it. It's hard. Right.
It's very tough. And a lot of people don't realize that lifestyle is such a big part in any autoimmune disorder. But can you talk, you don't have to give away all your secrets, but maybe just give some of your lifestyle tips that you do with your clients, maybe on what you call it, a 2-day immersion, or what do you call your?
So we do. So it's kind of an immersion experience. It's like a challenge we do. We run these every month. And that kind of leads into kind of the first thing we do with the client is doing what we call a thyroid remission consultation, where we'll spend about 60 minutes kind of identifying all the triggers and causes and history and background of all the things that could have led up to this thyroid, concern and problem. And one of the biggest things is then just kind of sitting down goals. If I could say anything to, folks listening today is that, make sure you let your doctors know your goals. It's probably one of the most important things, because a lot of, unfortunately what we do is we kind of say, you say I do, or I say you do, when a lot of times it's not necessarily what I want, it's what you want. Right. And so we want to make sure we're attacking, those specific goals. And so that's number one, is just making sure, you're finding a team that's, really getting, taken care of and making sure they're helping you and supporting you through the process. Support is probably the biggest thing, again, too, is just having somebody to keep you accountable. So a lot of what we do with, clients, we have like private groups we work with them. So once we kind of get from that immersive experience into a consult, we take them into what we call Thyroid Elite, which is kind of our elite program. And a lot of it is, like I said, support, where it's like every week we're working on getting 1%, 2% better. It's not about Band-Aid overnight fixes, because if there was a thyroid protocol or a supplement that would fix you, obviously we would all be great, right? But there isn't, but they do definitely support, right? I call a lot of it gap supplementation, right? Trying to get you from that hell to heaven. That the supplements can help us narrow that gap, right? And proper, right? And that's the key, is like using the testing. But yeah, the two of the best places to start for most clients, diet and lifestyle. So one of the most overlooked areas is blood sugar. 100% most overlooked area for problems we see, managing blood sugar. Blood sugar spikes and valleys can really flare up the immune system. And again, going back to what we talked about, getting TPO antibodies or antibody checks, every time you flare up the immune system and your thyroid is tagged with antibodies, it can damage your thyroid. And so when you damage your thyroid, that the autoimmune problem, that can damage your what we call thyroid follicles. And that's what helps you basically produce and store T3 and T4 hormones. So the more damage you get, again, over time, that's what's going to lead to a point where hypothyroidism kicks in, your TSH goes up, and now you're going down the line of meds. And so the problem is the more destruction you have, the more it's going to lead to a point where your thyroid just can't function anymore, and you're going to have to be in meds because you need the hormone. I mean, you need it for everything. So yeah, number one, blood sugar. Yeah. So if you can start tracking, and so we do something simple with clients, is that we just focus on tracking how much blood sugar or how many sugars we get in a day. So we kind of go through, hey, fruits, sugars that, get converted into things that get converted into sugar, right? We go through all the sugar substitutes, everything. And we look at how we can start trending that down. And that is again, powerful strategy. And we're not talking necessarily like complex things like ketogenic or, low carbohydrate, because that can be, again, that's something you got to be careful with, especially with Hashimoto's, because
for sure,
unless, and again, anytime you have that spike up and down, throws you into a flare, and that can damage your thyroid. So blood sugar, I would say number one. That'd be a big one.
That's interesting, because blood sugar, I think so many people now more than ever are having a true blood sugar issues. And a bunch of studies have actually come out with COVID saying, hey, if you have a high blood sugar and you get COVID, your outcomes are not good.
Yes.
And you know, a lot of people is like, well, I go to the doctor and they say I'm not diabetic. You're like, see, that's the thing. If you have a fasting blood sugar of 120, 130, you're not in a good spot.
No.
And so, or if you're having if you crave snacks every 2 hours, or if you need to take a nap after lunch, or you need coffee in the afternoon, you know, we're like, hey, look, these are all symptoms of poor blood sugar control.
Exactly. Yeah. We always tell, one of the easiest ways to tell, you know, when you eat in a meal, and you know this, when you eat a meal, you should have no change. There should be no change after that meal. It's just, you fuel your body and you move on with your day. If you're getting an increase in energy after a meal, or a radical decrease in energy, that's a sign of hyper or hypoglycemia. And people are like shocked by that. And that's the thing about sugar, is like, it's kind of one of those things, like, we all know it's bad in a sense. Like, I mean, it's not, you know, shocking to know like high fructose corn syrup, but it's what you just said, those ins and outs. It's when you look at the fasting blood sugar, you got those extra numbers, the insulin numbers, right? The hemoglobin A1C, which is kind of the lie detector test of what's really been happening. And there's all kinds of different cool little things you can look at. But yeah, it's not just like, oh, I shouldn't drink soda. Well, of course we know that, but there's a lot of X factors in there that you really have to watch out for. That's a great point.
Right. Do you ever have, I know it's kind of a new technology, but the continuous glucose monitors, do you have any clients?
Yeah. So it's great. Yeah, it's a great thing to use, especially to track. One of the things, that we really like to look at is 1 hour after meals, because that's that spike, postprandial. So they'll actually test that in labs, like LabCorp, but you do with a glucose monitor. So what'll happen is people will go, actually, I've been doing pretty good, doc. You know, it's like, I feel like I'm great, but then it's like, I still feel bad like a couple hours after a meal. And we'll go, okay, so typically if you eat a meal, obviously, and you test your blood sugar with one of the glucose monitors, it may go up 105, 110, pretty standard. You know, it'll start kind of getting in that range. Obviously, if you don't have huge spikes, that's an all right thing. But then what happens, we'll say, hey, test it like an hour later. And what'll happen is we'll have some clients that, no joke, they'll be like perfect right after a meal, no problem. But then like an hour later, the glucose is in like the 200s. And so they're getting that delayed spike, right? Which again is throwing up an immune system problem, a flare. They're getting damage, and now it's like trending in the wrong direction. So again, that goes back to, it's like, this stuff, it sounds complicated at times. It's just a matter of just kind of working with your body and just realizing there's a lot of tools that you can put in your tool belt to get these things under control. But it can get overwhelming at times. But yeah, those glucose monitors are awesome, because you can really look at a day and track, and you can monitor it. Oh man, it's awesome. Great thing to use.
Yes. And I think it's interesting because, you know, me and you, maybe we don't have any true autoimmune issues. Yeah. So we can eat something and have a blood sugar spike and it doesn't affect us. But if you have someone who's got Hashimoto's, that little bit of inflammation is going to be a lot more intense. It's going to have detrimental effects to those type of individuals.
Oh yeah. I mean, that's the thing. And that's the tough part. You know, it's like, you know, for us, it's, you know, and we work on this stuff though too. You know, it's like the last 10 years. I mean, prior to that, I mean, I was pretty dreadful with my diet and nutrition, but you know, last 10, you know, maybe 10, 15 years, you know, been pretty solid. But we still, you know, I still notice things in my body too. You know, I notice my digestive system gets a little out of balance if I eat this, or maybe have a little too much of that. And so we're all in different places. And that's another thing, you know, I'll say about Hashimoto and thyroid too, is that, you know, you got to be realistic about where you're at as well. You know, so one of the things that we'll tell clients is that, hey, we're not miracle workers. You know, even though it's like in our doctor network too, you know, probably thousands of testimonials, it doesn't mean it's going to happen for you, right? It doesn't mean, you know, you're going to get the change. We can only work that research, and we can only go, hey, here's where we're at. Let's try this. Let's do that for the next few weeks. And if it's better, great. Let's continue to do that and keep working on other things. We may hit a roadblock and go, man, that was dreadful. That did not work, but then we can shift. I think far too many people get sold that bag of goods, and it's all over the web, right? Where it's like, oh, dude, take this protocol and just do this process, and this is going to change it. And you know that, right? It's like, you know, it's like you may try a supplement. Well, number one, maybe you didn't have enough of it. Maybe you didn't get into a therapeutic dose. Sure. Maybe there was something you reacted to in there. With Hashimoto's, you tend to have a lot of different reactions. I know you know, for some of the companies you work with, very clean. There's a lot of products out there that aren't. They have a lot of cross-contamination with like gluten and things like that. And people are like, wow, that's weird. I took this pill and it's like, I feel like I should have got a change, but it made me worse. And then we go look at it, it's like, oh, wow, it's just lots of X factors. So again, just knowing that it's going to be up and down. And I think that's a lot of hope for some people, that even though it may have not worked for you before, it doesn't mean it's the end of the world, right? There's plenty of things to do. We just got to find out untangle that web, essentially, what all the different things are.
Right. And it's complicated. I'm sure you're working with clients for a long time, and sometimes you figure it out right away. Sometimes, hey, we need to eliminate this part of the, this food from your diet. Let's talk about, I know our time's limited today, so I want to do some rapid fire questions with you. So we talked about lab markers. Do you work with doctors? Is every patient that you work with on a medication or not on? What's the mindset?
Oh yeah, 100%. So the deal is, the problem is the very first thing, and a lot of this stuff, one of my mentors, Dr. Karazian in the Karazian Institute, and he does a lot of work with Hashimoto's. And so I surround myself with a lot of people smarter than I am. So it's like, let's work their research because they've done it before. Don't reinvent the wheel. But the one thing that he says that is the first thing with anybody Hashimoto's, you can't be in a severe hypothyroid state, and you can't be in a very severe fluctuating state, or in like a, God forbid, a grave situation. And what I mean by that is you're switching between like hypo symptoms, like you're fatigued, you can't get out of bed, your mental capacity is very worn, to, or cold intolerance is another big one, to, God, I'm getting hot, I'm sweating uncontrollably, I'm hyperactive, I can't get to bed, I'm anxious, I'm nervous. When you have these big swings, that's the time where you do have to look at management. And look, I am a anti-drug person to the core. If someone told me I could fix my problem by standing on my head in the corner, I would do it before I would want to take a medication. But when it comes to, thyroid hormone, if you're severely hypothyroid, you're going to need it to get balanced first. Then what'll happen is then we start working on those holistic strategies. And then what we'll find is, over time, doctors can then start to reduce medication. But you do have to find the right doc, because a lot of docs get very attached to their particular protocol and won't try different things. And that's the thing, just finding the right people. So yeah, we definitely do.
Yeah. Awesome. Okay. So let's do kind of a rapid fire part of this. So let's talk about gluten and thyroid or Hashimoto's. What are your thoughts? Can some people on Hashis tolerate gluten, or is everyone to avoid gluten completely?
Typically, man, it's just gluten is a pretty problematic for most people. Yep. I don't see too many people getting back on it. Yeah, it's a very tough one.
Yep. Yeah. And how many people are eating gluten that are having flare-ups and they don't realize?
So a lot of gluten sensitivity. Really, the two factors are gluten sensitivity. It's tough because you'll get a little bit of delayed reaction. So it's hard to. So if you're gluten sensitive, a lot of times you may not necessarily note it, or you'll get a delayed reaction like a day later, where it's like, now like I'm foggy, I've got gut problems, things like that. Now, if you're a Hashimoto and you have celiac, changing gluten could change your life completely. So I'll get two cases with the celiac cases where they've been diagnosed celiac, whether it's by the genotype or they've got tested, or LPS in their system, whatever it may be. Those folks, they remove gluten and it's like life-changing. For gluten sensitive people, where they have a problem with it, they'll notice it's better, but it may not be like a life changer, if that makes sense. And that's kind of what we tend to see. Yeah. Nice.
Okay. Let's go over Goitrogenic Foods. That's a big topic of discussion for thyroid.
Very interesting. So there's a lot. Okay. So again, all my research, research of smarter people than me, with Goitrogenic Foods, the reason you see a problem with them is you've got to look at the research itself. So goitrogens are going to be like, broccoli, cauliflower, you can look them up on Google. So if you're listening, look them up on Google. There's tons of different goitrogenic foods. The idea is that when you eat these foods, they will compete with your thyroid hormone. And that's what's going to drive up your TSH, put you hypothyroidism. That inflames your thyroid, gives you goiter, right? So that's the concept. The issue is most of the research for goitrogenic foods were done in vitro, meaning in a test tube. So much of the research now, if you look at over the last 5-10 years, that have done on human testing, meaning they would look at populations like vegans consuming high goitrogenic foods. They would give people, heavy doses of cabbage and broccoli and things like that. In human testing, they've actually showed really no problem with goitrogenic foods. Now, again, if you look at in vitro, you would see some competition and some problem, but in human testing, not only did they find no problem with goitrogenic foods, they found a lot of these foods had protective benefits because they raised antioxidant pathways, specifically pathways like glutathione, which we both know glutathione is one of the greatest antioxidants to help with overall inflammation reduction and just body function in general.
For sure.
So believe it or not, we actually tell our clients, eat more goitrogenic foods. Crazy. And that's a very, again, and it just look at the research. It's very interesting in vitro testing versus actually human testing. And this is, we went over this in our last conference with Dr. Krasing, and he was just like, man, the research is clear. So kind of a controversial take on it, but I invite you to go look at it, and it's pretty wild.
Nice. No, that's why I asked you. So I got another controversial topic for you.
I know what you're saying.
Let's talk about iodine and Hashimoto.
Iodine, yes. Yeah. Okay. So again,
I've heard both ways. I've heard research on both ends.
So I would have never thought the opposite. So look, I'll say this in certain cases, obviously for just early on thyroid, things like that, there could be some iodine deficiency but I'm kind of just speaking to the Hashimoto group. In terms of the Hashimoto group, they have actually shown, again, more research showing iodine flaring up the thyroid. Crazy. But I've got actually a list, and I'd love to send those over to you if you ever tag them, but I've got about 4 to 6 amazing research articles showing as iodine increased, it actually caused more of a Hashimoto flare. And the reason is that a majority of the people that are actually having thyroid hormone issues is, again, due to destruction of follicles, not because of a lack of iodine. Because our thyroid actually contains a lot of stored hormone, but we're just not releasing it because of our levels, right? It's all based on our blood concentration. So downstream, if you have all these problems, that can really limit your ability to release that stored hormone. Most people then start taking iodine, and believe it or not, again, if you know you have TPO antibodies, and you have that autoimmune portion of it, iodine plus that TPO antibodies leads to destruction. Now, here's what will happen. When you destroy your follicles, it actually releases stored hormone. So 2 things happen. Number 1 is that if you're in a hypothyroid state, high TSH, it'll actually drop your TSH, and a lot of people feel better, even though their thyroid's getting destroyed because of the iodine consumption. Second scenario is that we've had people that were on thyroid replacement, and because their levels were already down, their TSH levels are down, that iodine plus the TPO led to destruction, released hormone, and dropped their levels further. They actually made them hyperthyroid.
Interesting.
Crazy. Very interesting. And again, they did this in a couple areas. In Japan and Slovenia, they actually increased iodine content in table salt, iodized table salt, from like 10 to 25 milligrams. They saw a double of Hashimoto's over the next few years. There were some other amazing research studies showing increase in iodine and especially like seaweed, showing Hashimoto's flare-ups. And then they did the reverse, where they had people go on, believe it or not, iodine diets, reduction diets, where they eliminated iodine, and they're actually showing people dropping their TSH and dropping their antibody counts. Crazy cool research. And so kind of interesting concept. But again, do some people may need it? Potentially, yes. You really just got to be careful because a majority of people, have stored hormone. There's not releasing it, if that makes sense.
Wow, that is super interesting, Doc.
Crazy.
Thanks for sharing that. Yeah, if you could, send me those links. I'll put it
down.
Yeah, I will.
Yeah.
So people can, check it out.
Yeah.
I've heard this time and time again, and it's hard to know exactly. Yeah. What's right. So I've heard, iodine for some individuals, like putting gasoline on a fire, it just ignites.
Yes. The NF-kappa B, TH17 pathways and things like that. So, again, the big words but it's like, it can fuel in the fire. You're exactly right.
Right. But then I heard other doctors saying the other thing. So I need to, everyone just do your due diligence,
And that's the biggest thing. Look, it's got to make sense for you. It's like, that's the one thing I love about our type of field is that, we'll present this stuff and we'll say, look, hey, in the end, it's up to you, right? It's your body, right? It's like, I can only say, hey, we can try this or we can try this, right? And that's half of what I love to do is that we don't guarantee anything. We can't promise anything, but all we can do is present what we have. And in the end, it's up to you to make that decision, which is really cool. That's the best part about holistic nutrition. It's not, I say you do, right? It's just, It's all about a team, and that's the power of it.
Yeah. Making an informed decision. You have time for one more question, Doc?
What's that?
Do you have time for one more question?
Oh yeah, please. Yeah, I got you. Oh yeah, I've got more. Yeah, we're good.
Okay. I want to talk about adrenal function and the tie-in to thyroid. Do you do any lab testing for cortisol and hpa-axis dysfunction?
Yeah, absolutely. So, there's obviously up in the air whether serum is better or salivary hormone testing is better. We've seen some benefit in both, but yeah, absolutely. Some of the different salivary hormone testing and looking at cortisol. I mean, obviously for some people, sleep is a huge thing for obviously Hashimoto and anybody autoimmune. So you need sleep. And so a lot of times we'll run to see if, a particular person is, getting a cortisol spike in the middle of the night and that's what's waking them up, or it's maybe just they're just not eating enough protein and they're just not getting through the night, or, maybe they're just having trouble just going to the bathroom in the nights. But yeah, one of the things we run for that is definitely for, looking at to help with sleep, but then overall throughout the day of how their cortisol levels are moving. But yeah, adrenal has a huge crossover. That's definitely one of the researched areas in terms of helping to support the thyroid, because it's got to be clear. Yep, absolutely.
Right. And it has a direct connection to blood sugar. If your blood sugar's
100%, yes,
all over the place, yeah, cortisol's all over the place.
And that's the thing, it's a lot of this stuff. It's like people get so frustrated at times because there's so much out there, but it's all connected in a sense. And you can't throw everything up against the wall and try to make it stick, right? You have to just work on particular things. So for client A, we may run some cortisol and salivary hormone testing and with traditional blood testing. Others, we may run some gut work, and then we may do the traditional blood. I like to run blood on everybody, just a comprehensive scan, just to look under the hood, because then we can kind of points us to the direction of where we want to go. Maybe it's food testing, maybe it's, like I said, a salivary testing or adrenal testing or gut testing, whatever it may need for that particular client.
Yeah, I'm a big proponent of test, don't guess. Really find out what your lab is. Look under the hood.
Yeah.
Get some blood work done. You can go places now that are very convenient. Any lab test now, you can go to LabCorp.
Yeah.
So these are
it's great. Yeah, and it's crazy how many people. It's like you get these labs back from some of the just traditional docs out there, and it's like there's like 4 markers in there. I'm like, wait, I mean, your body is more than 4 markers, and same thing for like Hashimoto's. TSH test is great. Good for a baseline. Hey, we got a baseline to see how it moves up and down, but hey, where's everything else? Because that hormone affects so many other places, and that's the key.
Right. Well, we have probably time for another 2 more podcasts with you. So
yeah,
I know your time's limited. So thank you so much for coming on today.
I appreciate it, brother.
I love that picture of the thyroid in the background.
You like that?
I love that.
Yeah.
And for anyone listening, can you tell people where to find you online and on social media?
Yeah, probably the best way. So like I said, we run a free Facebook group called Transform Hashimoto's and Hypothyroidism Naturally. And so you can search us on Facebook. I mean, you also can just go to hashimotoreset.com, and then has the links to join that group, and kind of has some info on the remission consult, and there's probably some great places to start. But we do Q&As in there every week, and I'm sure we're going to have the doc in there as well for anybody of my people listening, because we'll blast this out when it goes live. And yeah, we're definitely, that's probably the best way to find us and kind of learn some more about how we work.
Awesome. Well, Dr. Meers, thank you so much for coming on today. I really appreciate it. You definitely presented a lot of helpful information to a lot of people listening. So we really appreciate your expertise.
Yeah, I appreciate you too, brother. Thanks so much for having me.
All right, man. Have a great weekend. Talk to you next time. All right.